I'm Carrie Veillette. I am a clinical social worker with the STEP program, and I am also the liaison for our Mindmap campaign and detailing some of the first responder groups, so law enforcement, mobile crisis clinicians, the judicial branch side of things to help get our message out there. So I've worked in the mental health field as a whole since about 2009. I got my clinical degree back in 2016, and at that time was working as a case manager with older adults with severe mental illness. I was privy to Yale's STEP program at that time. I kind of worked in the same building as them, and when a job opened up and I was asked to come on board, I was very excited about the opportunity to target young adults because I saw the other side of things, right? Folks who weren't able to get access to care when they were younger. Certainly the mental health field has changed a lot over the years. So I was excited about the opportunity to see the preventative side of things and how our engagement with these young folks might be able to prevent some of the challenges that I was managing with these older folks who, again, didn't have access to the care that these young folks do today. So through the Mindmap campaign, we're trying to target all aspects of the community to make sure that our message is being heard for folks to get connected, young folks to get connected to care as soon as possible. And so with my clinical degree, part of my work at that time for an internship was at our mobile crisis team. So I was really able to see firsthand the mobile crisis response, the police involvement with that. We have an agency that works closely with the New Haven and West Haven PD. And so it really kind of held an interest of mine, the ability to go out and manage crises in the community. Obviously, with my role at STEP, we are very much in the building, providing support to the young folks, but there's so much work outside of the office that can be done as well to help these folks when they're in moments of crisis early on in their illness. That with this campaign, we thought it was very important to target those first responders. So I've had the pleasure of being able to attend CABLE, which is the law enforcement training opportunities for crisis involvement. So I've attended their 40-hour training and really was able to get a good sense of the police department side of things, the first responder side of things, what they entail when they show up to a crisis call. And so it's been helpful to guide our approach and how to teach de-escalation skills, show up to these calls the best way possible so everybody has good outcomes at the end of it. As I'm sure you're privy to, resources are always in need across. I think Connecticut is very lucky in that we do have a variety of mental health resources, that many of the states don't have across the nation. And so I do think we are fortunate enough for that. But I think what it really comes down to is the resources and just training opportunities, educating police officers who have been trained in such a way to how they, for many, many years, have shown up to calls, again, trying to just de-escalate situations any way possible. And a lot of times that was use of force. And we've been able to see over the last few years, granted this is not with the work that we're necessarily doing, but we're sort of adding on to that, by having good communication skills with folks, understanding the other side of things, what you're showing up to when you go to a crisis call, what mental health conditions you may be seeing at a crisis call, and how showing up for each of those different conditions can be most beneficial to everybody involved.
So it's really
Yeah, I think for, again, long time, police departments in particular have been encouraged to go to the ED, right? People are here in crisis, send them to the ED. That's maybe not necessarily the intervention that everybody needs in a crisis moment, but that may be the only resource that the police officers have awareness about at that time. So by our referral line being created and then getting disseminated across the state, I think with the education nuance, in addition to this referral line, police officers feel better equipped to say, okay, is this somebody who needs to go to the ED, or can I leave this person because they are safe, their family member is here, and this caregiver or this number can be given to the caregiver to get these folks into treatment that best suits their needs at that time, because as we know, the EDs are overran and again, lacking resources for a lot of these things. And so I do think that the referral line can be helpful, and we hope it to be helpful to lower ED visits, but also get folks into care that doesn't necessarily need to go to the ED or an inpatient unit first.
Is part
I think it just really comes down to education, training, knowledge. I think the more we know, the less we can go based off our biases and assumptions, right? And again, I think when it comes to the law enforcement side of things, they too are fueled by stigma, right? I mean, they're civilians just like we are, and if society is fueling some of these stigma behind psychosis, schizophrenia, kind of any psychotic illness, they're showing up to calls with that mentality, right? And so with the piece of education and training, again, as I mentioned, they can better understand what they're showing up for, how they can show up in the best way possible for that individual, so everybody has good outcomes and stays safe. Yes. And I think, police get knocked a lot of the times for, some of the ways that they engage with community members. Certainly there's been a lot of issues in the past historically with this, but again, I think with our campaign, our knowledge and our education being disseminated, our hope is that over time, community members don't have to worry about having police involvement with these calls, right? They know that their caregiver, their loved one, will be safe when a police has to intervene because everybody is aware of the situation and how to best support and handle that moment.